This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on this Monday morning. WAJR 104.5 FM, 1440 AM. And Mon Health Talk, our special guests this morning, Dr. Erica Arthurs and Dr. Amanda Sherman. And ladies, good morning. Thanks for joining us on the show.
Good morning. Thanks for having us.
We like to get to know our doctors. So let's start with that. Dr. Arthurs, tell us a little bit about yourself, where you're from, and what brought you into the Mon Health system.
So I'm actually from Morgantown. I was born and raised. I did my undergraduate training over at WVU, and then I went to medical school also at WVU, did my residency training in OBGYN there. So born and raised, stayed, didn't make it very far out of Morgantown, and that's one of the main reasons I wanted to stay at Mon was because I have family here. I love the system. They provide great care, so that's one of the reasons I decided to stay.
Okay, Morgantown High or University?
Morgantown High.
Morgantown High. Okay.
Yeah.
And in terms of your education, how far back? What year did you graduate from Morgantown High?
2006.
Okay. So lifelong resident, and you found a home here at Mon Health. Again, what makes that facility and the organization, what made it attractive to you?
Well, it's it's got a great reputation in the community. Everybody wants to go to Mon Health for their care. We have a wonderful birthing center here, so in terms of OBGYN care, it has great facilities, wonderful nurses. So that was the main attraction. My partners here have been amazing. So everything about it was just perfect for what I wanted to do.
Okay. Dr. Sherman?
Yes.
Your background and what drew you to Mon Health?
Well, I am from a small town in Grant County, West Virginia. And from there, I went to the West Virginia School of Osteopathic Medicine, which is in Lewisburg, West Virginia. Graduated there in 2006, and then went on to do my residency at Charleston Area Medical Center down in Charleston. I finished there in 2011, and then went home for a little while to work in my small local hospital before actually meeting a Morgantown native who I became engaged to. And then when we got married, I relocated to Morgantown, and at looking at really job opportunities here, Mon Health was just really appealing because we had a nice balance of all the conveniences and lots of interventions available in bigger hospital systems, but still having a more small town, personal, intimate feel as far as I think how we relate to each other as colleagues and staff and to the patients.
Okay, so both of you ladies are local products, or at least products of the state of West Virginia. It's great to hear from you both, and that neither of you had to leave the state. You hear about that so many times. You have to go somewhere else and get back to West Virginia, but both of you have made a career here.
Yeah, it's hard to leave West Virginia once you're here, and it's great that Mon Health has opportunities for us to stay and be local. Okay,
OBGYN, the specialty for both of you. Dr. Arthurs, what's your main focus in terms of that practice?
Well, I practice general OBGYN, so I practice obstetrics, so caring for patients during their pregnancy, before pregnancy, after their pregnancy's over, and then gynecology care. We provide annual exams. We make sure people are up to date on their screenings. We do pap smears, provide contraceptive services. We do surgical procedures as well. So we perform hysterectomies, do gynecologic procedures, and then C-sections as well for our obstetric patients. So we kind of have a wide range of things that we do, which is one of the reasons that I loved OBGYN so much, is we just get to do a lot of fun things.
Mm-hmm. Dr. Sherman, same question for you.
Yeah, I think that I found OBGYN really appealing for a lot of those same reasons. I can remember doing my first delivery and just thinking, wow, this is truly my calling in life. But as I have worked and studied in this field, I think, I'm really fortunate to be able to have a very wide scope of practice, from almost functioning in a primary care capacity with women's annual well woman visits, to helping with their problem GYN visits, to caring for them during their pregnancies and afterwards. It's really just kind of a nice, well-rounded field of care for women throughout their entire life.
Mm-hmm. Now, both of my children were born at Mon General, so up there on the fifth floor, I believe, fifth floor.
Yeah.
My youngest is 23, so it's been a while. What's changed? Obviously, there's so much new technology, and it's changed so much, and I'm sure that entire facility has been remodeled probably several times since my kids were there. What type of services do you provide? The birthing center on the fifth floor, just discuss the changes and kind of the updated methods in the last couple of years.
Well, I would think when somebody walks into our birth center, you'd be very impressed just by the aesthetics of the birth center. I feel like we have very comfortable setting for family. The rooms are large with comfortable furniture. So if you're going to be checking in to spend a few days with us, we do try to make it feel homey. We have a top-notch security system, which is something that, thankfully we've never had to implement, but it's available in case there would be any issues with security breaches. And then just in general, we do stay up to date on all of the latest equipment. For example, we've just started using a new device to help control postpartum hemorrhages that's not being really widely available yet. And I'm sure Dr. Arthurs has some other things as well.
Yeah, we have, like Dr. Sherman said, large birthing suites for all of our patients. So you don't have to be moved from one room to a smaller room once you're delivered. You stay in the same room with large tubs and all the available amenities with the birthing suite. So, and the other thing I like about it is it's kind of off the main area of the hospital, so it's very quiet. Like she said, the security system makes you feel very safe. So I think it's a wonderful place to have your baby.
Mm-hmm.
We also have a dedicated operating room on the fifth floor too for any kind of emergency settings, which we're always ready and well equipped to handle anything that comes up unexpectedly during the birth process.
Okay. We are visiting with Dr. Erica Arthurs, Dr. Amanda Sherman, Mon Health OBGYN, and you both gave a wonderful description of the fifth floor birthing center there at Mon Health. Where do you see your patients? Obviously, you both spend a lot of time on that fifth floor, but do you see patients off-site as well?
We are in the 2000 building of the Mon Health Medical Park, so we're basically just down the hill from the main hospital.
Okay, and both of you are located there?
Yes. Yes.
Okay, very good. How would people get in touch with you or get in touch with your office if they're interested?
Well, we have a website that you can learn more about our services and the providers that we have here, monhealth.com/OBGYN. You can also call our office. It's 599-6811 to make an appointment and schedule you or your loved one to be seen.
Very good. It is Mon Health Talk for this Monday. We'll take a quick break, continue with the conversation after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. 104.5 FM, 1440 AM, WAJR. We are visiting with Dr. Erica Arthurs, Dr. Amanda Sherman, Mon Health OBGYN. And May is Women's Health Month. So, doctors, let's talk about that a little bit. The importance of women to see, first of all, their primary care provider or their gynecologist. Let's start with you, Dr. Arthurs. What would you say to a woman who may not necessarily have be pregnant or plan on getting pregnant? Still, it's very important to get in with your primary care provider and get that routine going.
Absolutely, yeah. So women, even if they're not pregnant or having any issues, should still be seeing either their primary care doctor or their gynecologist every single year. We start doing cervical cancer screening pretty early on in life. We start at age 21. So, getting established in your teen years and in your early 20s is really important to prevent cervical cancer. And we also, anticipate issues that may come up when girls start having their periods and having issues there. So it's really important to start seeing your gynecologist, in your late teen years, early 20 years, because we do have some routine screenings that we need to start early on. And then later on in life, we have other screenings that, we should be keeping up with every single year. And we can talk about that later too. But, there's a lot of things that we have to keep up with as women and to prevent issues down the line.
Mm-hmm. Dr. Sherman, you talk about the issues that women have to deal with year to year. What are the most common things that patients come to you and they're concerned? This may or may not be normal. What are some of the basic things that patients come to see you about?
I think it's interesting sometimes to see how many patients I'll meet in the course of the day that have been coping with things that they consider to be normal for years, but they're not necessarily normal, and we can maybe have interventions to help with that. And that's things like women that are having extremely painful periods or heavy periods or pain with intercourse. Sometimes older patients think that incontinence is just a normal transition in life, and that's not necessarily the case, and there are things that we can do to help with that. Some women who are going through menopause may think that, they are just destined to have to deal with hot flashes until they resolve. But again, there are things that we can do to kind of help women through these different stages in their life. And even though they might think it's normal, it doesn't mean that they have to necessarily accept it and not seek out help. Okay,
so that's interesting, the fact that you see women of all ages, right, from their teenage years all the way through post-menopausal women.
Yes.
Okay. Dr. Arthurs, again, all stages of life. Just discuss that a little bit about how important it is to your specialty OBGYN, but women need to see doctors, before and after they have children.
Yeah, absolutely. Yeah, when you're a teenager, contraception's a really important thing that we talk about with our patients and address. When girls start their periods, a lot of times they are painful and irregular, and sometimes we can help out with that. Then starting your pap smear screenings, and then later in life doing mammogram screening. So making sure we're keeping up with mammograms and breast exams to prevent breast cancer, which is very important for women in their middle ages. And then, like Dr. Sherman says, post menopausal patients may have issues with hot flashes, menopausal symptoms, and then if they have bleeding after menopause, that's something that we really need to look into. So we have to address that if that comes up too. So we see a very wide range of ages in our office every single day, and it's really important to keep up with it so that we can keep you on track with all the screening.
Dr. Sherman, what about ladies who are having a difficult time getting pregnant? What type of things can you do to help a couple who's having a difficult time conceiving?
We do offer infertility services here to a certain degree, and oftentimes that will involve bringing both the male and female partners into the office just to do a thorough history and examination on the woman partner, and then starting a pretty in-depth workup, everything from semen analysis to labs on the female, ultrasound studies to evaluate if they have potentially tubal factor infertility or ovulatory disorders. So there are some medications that we can help with as far as ovulation induction, if that seems to be a problem hampering getting pregnant. Some surgical interventions that we can offer if the patients have anatomical issues. We do not offer reproductive endocrinology services such as in vitro fertilization, but we can do a pretty thorough workup up until that point.
Okay. Post-birth, there's many things. One of the big ones is postpartum depression. And Dr. Arthurs, back to you for this one. What type of services do you provide for moms who may be struggling?
Well, we really like to monitor patients throughout their pregnancy for depression because sometimes it can kind of manifest during the pregnancy. So we're really good about screening patients during the pregnancy. And then we also have what's called our P3 program, which we've started implementing over the last couple of years, where we have dedicated nurses and providers that will contact patients if they've been struggling, contact patients after their delivery to check and see how they're doing, and so that we can catch the postpartum depression early and then treat it and get them into the appropriate doctor's offices or counseling offices for treatment. So we have a really in-depth P3 program, which our nurse Jennifer Bender runs, and she does a wonderful job with that.
Okay. Dr. Sherman, what about breastfeeding? I would imagine there's some mothers choose to do it, some don't. I would imagine there's some guidance there in terms of the best thing to do for the mother and the baby. Just discuss that a little bit. And obviously that's a big change for a mother when they decide to breastfeed, and it's important that the baby get the proper nutrition whether the mom chooses to breastfeed or not.
It certainly is. Mon Health is a baby-friendly hospital, so all of our nursing staff has gone through hours and hours of education as far as lactation and helping to support our moms at the hospital right after delivery. And then we also have Jennifer Bender again in our office who serves as a lactation consultant as well. Dr. Arthurs and I both breastfed our children, so we have been there. We have firsthand experience of what that is like, and it can be a little bit of a struggle. There is a learning curve there, so I think making women feel supported and just giving them the help they need to get them started off in the right way is kind of critical, because really breast milk is the optimal source of nutrition for our babies, and it has been linked to having such wonderful benefits for both mom and baby that we really want to encourage that to happen if it can.
We are with Dr. Erica Arthurs, Dr. Amanda Sherman, OBGYN specialists at Mon Health. What would you say to a person is out there who has a daughter or a granddaughter? When's the right time to get them started, a young person started with an OBGYN or a gynecological specialist?
Anytime, really. I mean, we will see patients from their young teenage years, in their early 20s. If they're not having any issues, at least by age 21, so we can start your pap smear screening. But if you're having issues with your periods or, you really want to get comfortable with your gynecologist before you start the pap smears, I would say in your early or late teen years, it would be a great time to start coming to see us.
Very good. And that's monhealth.com/OBGYN for more information. Ladies, great information. Great job today. We appreciate your time, and I'm sure we'll be talking again.
Thank you so much.
Thank you.
Thank you. Dr. Erica Arthurs, Dr. Amanda Sherman, Mon Health OBGYN, the focus of our conversation today on Mon Health Talk. Thanks for listening. 104.5 FM, 1440 AM, WAJR.